Good afternoon, everybody. Today is Friday, January the 15th, 2021, and I want to be updating you on COVID-19. So in Canada, we have 69,004,412 cases confirmed in Canada today. Alberta has 11,585 cases, 1,389 deaths. British Columbia has 59,608 cases, 1,338 deaths. Manitoba has 27,125 cases, 760 deaths. New Brunswick has 884 cases, 12 deaths. Newfoundland and Labrador has 395 cases, 4 deaths. Nova Scotia has 1,550 cases, 65 deaths. Ontario has 223,001,308 cases, 5,289 deaths. Prince Edward Island has 104 cases, 0 deaths. Quebec has 23,008,745 cases, 8,938 deaths. Saskatchewan has 19,715 cases, 210 deaths. Northwest Territories has 24 cases, 0 deaths. Nunavut has 266 cases, 1 death, and Yukon has 70 cases and 1 death total. So these are the cases that we have in Canada. So our top story is with the vaccine. Canadian is on rapid growth trajectory. 2,000 more people could die from COVID-19 in the next 10 days. New modeling released by Public Health Agency of Canada suggests the numbers of daily COVID-19 cases could be more than triple to 30,000 if people increase their contacts during their time of widespread community transmission. The report also projects that if Canadians simply maintain their current levels of contact with people outside their household, case counts will still rise to roughly 13,000 a day from 7,900 now. The modeler said that based on current cases counts, Canada remains on rapid growth trajectory with roughly 2,000 more people expected to die over the next 10 days. As the country approaches to death total 20,000, as many as 100,000 more people could contract the virus over the next week and a half. Quick, strong, and sustained measures are needed to interrupt rapid growth and maintain COVID-19 control, said its report. Reducing COVID-19 activity is urgently needs as rollouts of safe and effective COVID-19 vaccine begins. Chief Public Health Officer Dr. Theresa Tam told a news conference that the vaccine rollout, which is now protecting priority groups of high-risk Canadians, will not have a big impact on the numbers in the short term. In terms of the national projection and transmission in communities, you're not going to see that in the initial months, which is why I think our message is to absolutely get on with the public health measures, she said. Do all of those things, don't not essential travel are all really count. It works, and when you can suppress the projection, the vaccine have a longer runway. Deputy Chief Public Officer of Health Dr. Howard said government and external experts are working to determine the impact of vaccine rollouts on numbers of mid and long term. But in a present time, it's really difficult to say. There are so many factors involved. Even today, we're seeing issues in terms of vaccine supply. How many vaccines are being rolled out across the country, he said. There are other factors in terms of increasing rates of infection in various parts of the country. So there are many different factors to play. Right now, Alberta, Ontario, Saskatchewan, and Quebec are the provinces reporting the highest infection rates per 100,000 people. Tam said many provinces, including some that had been on downward, saw a sharp rise in daily case numbers after the holidays. That's likely due to people having more contact over the holidays and reduced testing during those weeks, she said. Since the holidays, stronger community levels public health measures have been adopted across Canada, and some areas are showing that the public health measures are working to slow growth. However, we have yet to see the widespread and sustained declines in daily cases counts that could indicate we are bringing the pandemic under control nationally, she said. Some 10 months into this pandemic, long-term care homes continue to report hundreds of daily cases. There are now more than 400 outbreaks nationwide, a situation which is expected to push hospitalization rates higher. Still, Alberta and Manitoba are reporting the highest rates of hospitalization per 100,000 people. During a news conference outside his residence in Rudo Cottage, today, Prime Minister Justin Trudeau said the outbreak now occurring in long-term care homes in Ontario and across the country are tragic. Our parents and grandparents built this country. They raised us and they deserve so much better, he said. In a virtual that we continue to give vaccine to vulnerable people as quickly as we can, and that's exactly what we're focused on. But remember, no one is invisible. Even if we're young and healthy, this virus can be very dangerous, and that's why we will have to keep doing our part. Trudeau said the white vaccine are rolling out across the country. Canadians must reduce their in-person contact. For the moment, that's the only way to get these numbers down, he says. Since yesterday, Ontario is now under a stay-at-home order. That is a kind of tough but necessary decision that provincial governments are having to make. Calling on new modeling alarming, NDP health critic Don Davis called for stronger federal measures to reduce the spread of the virus. The number released today paint a very picture, he said. COVID-19 is claiming the lives of 145 Canadians every single day, and situations getting worse. Clearly, we've been doing isn't working. Forecasts show that the stronger response is necessary to slow the alarming spread of COVID-19. So that's pretty much what happened, and that's Dr. Teresa Tam that was talking um, today for the COVID-19 vaccine and all that stuff. Now we're going to be moving on talking about um, another thing I want to talk about. Yeah. Trudeau says bloc leader is using coded language in attack on Transport Minister Omar Al-Jabra. Blanchette said he was only raising questions about Al-Jabra's ties to political Islamic movement. Prime Minister Justin Trudeau today accused Bloc Quebec leader Yves Francois Blanchet of pandemic to the worst element in Canadian society by using coded language to make intolerant statement about newly appointed Transport Minister Omar Al-Jabra. I was absolutely floored to see a federal party leader using that and carefully coded questions, particularly last week when we just lived through last week what happened when leaders don't take care of the words they use and play these dangerous games around intolerance and hate, Trudeau said. Al-Jarba, who received his first ministerial post in cabinet shuffle Tuesday, was signaled out in the Bloc press release that to sow doubt about his accusation with that it called the political Islamic movement. Blanchette said Wednesday that the question arises due to the minister's former role as head of the Canadian Arab Federation. Blanchette also said he refuses to accuse the minister of anything specific. Blanchette cited a 2016 article by right-wing Quebec newspaper columnist that made suggestions about Algerba's personal and professional history. It's really question about his post and also the separation of church and the Senate, which is the profit value for the bloc, said bloc spokesperson Julian Colbin. We don't want a race of any accusation because I don't think there is that much. In 2009, then the Citizens and Immigration Minister Jason Kenney opted to cut funding to the Canadian Arab Federation, whose leader at the time made statements that Kenney called anti-Semitic and supportive of terrorism groups. Earlier today, Blanchette accused a statement saying he was only raising legitimate questions about the past positions Al-Bajabra had held at the Canadian Arab Federation and accused the Liberal Party of refusing to allow Al-Jabra to answer questions raised against him. Trudeau appeared visibly upset with the suggestion that Blanchette could accuse his remarks as an effort to simply ask questions about Al-Jabra's approximately the political Islamic movement. That's ridiculous, Trudeau said. That's the kind of political pandering to the worst element and to fears and anxiety has no place in Canada, and all of us need to stand up strongly and push back against anywhere it happens in the country. So Prime Minister was upset because the Quebec leader used bad language, and that wasn't right for that to happen. Now we're going to be moving on talking about um, PM says Ottawa is looking at banning certain flights. Prime Minister Justin Trudeau said today the federal government is strengthening pandemic restrictions on in, international travel as concerns mount about Canadian traveling abroad, but suggested the government's pre-existing measures are still effective. Our measures have been very strong, but we've always open to strengthening them as necessary. He said when asked if the government would consider a ban on international travel, "We're always looking at various measures as they are effective elsewhere in around the world." Trudeau insisted that Canada mandatory 14-day quarantine for those crossing into Canada has been extraordinarily effective. Earlier this month, Intergovernment Affairs Minister Dominic Liban pushed back against claim in the Government of Canada can legislate to limit travel outside the country. If we look around the world, it continues that have requirements for exist various. I'm not sure we want to be on the list of those countries, but any measures that tells Canadians that non-essential travel internationally should not be undertaken is something that we're prepared to look at, he said. The Prime Minister did say Friday the government is looking to ban certain flights as new variants of COVID-19 emerge around the world, such as new Brazilian variant of the coronavirus. Canada temporarily banned flights from the United Kingdom last month as new coronavirus variants spread there. We're doing whatever it takes to protect Canadians, including looking at banning certain flights. If necessary, decisions must be made based on public health guidelines, he told a brief outside at home at Rudo Cottage. As always, our ministers are effectively leaning in on and talking to experts to reach a determination without delay. We will continue to keep Canadians informed of any new decision we take. Trudeau took multiple rounds of questions today about air travel in response to recent controversy involving Canadians traveling abroad in defiance of federal government's advisory against non-essential international travel. A recent story showed that Canadian air carriers have operated more than 1,500 flights between Canada and 18 popular vacation destinations since October 1st, even as caseloads increase and health crisis depends. Provincial politicians, federal MP and senators, and some executives have become enrolled to controversy over travel. The Canadian government has had an advisory in place urging Canadians non-essential international travel since March 14, 2020. Canadian citizenship are permitted, residents are advised to avoid all non-essential travel outside of Canada until further notice to limit the spread of COVID-19. So these are what's happening in Canada and around the world. Now I'm going to be moving on talking about other stuff. I'm going to be moving on talking about Edmonton. So Edmonton, Scott McCain won't seek third term as downtown city councillor. Scott McCain will not run in fall municipal election, CBC News has learned. McCain in the second term and eighth year of representing Ward 6 is the city's downtown. There's a couple things that I'll be very proud of, but I didn't do them. We did them, McCain said in an interview Friday. I've learned a lot. I've enjoyed a lot. I've met amazing people, but I just feel like it's time to hand the brace ring over to someone else. McCain was first elected in 2013 when Don Iverson was also first elected as mayor. McCain has been a strong champion of helping homeless people, with Edmonton now planning 900 new spots for permanent supportive housing. He also helped from the city anti-racism advocacy committee. Downtown has evolved dramatically over the 2 terms McCain had been in office. The city had precedent over the development of Ice District and Rogers Place. The city has also made streetscape improvement to Jasper Avenue, Churchill Square, and Stain Murray Library. McCain admitted to some decisions were tough. Every time you make a decision as a city councillor, you make some people happy, but you make a lot of others really unhappy, he said. I think that wore me after that time. One tough decision was agreeing to a supervised injection site in Chinatown, which was met with strong opposition from the community. Not really to retire, McCain was a reporter and columnist with Edmonton Journal for 24 years, but he said he's not ready to retire. Going forward, he said he'd like to be an advocate for mental health and addiction, or work in communication or journalism again. McCain is a third sitting councillor to announce he's not running for re-election. Michelle Walters in Ward 10 and Ben Henderson in Ward 8 will also not seek a re-election. Mayor Don Iveson is not seeking the mayor chair in 2021. Nomination for Aspin City Councilor, Mayor, and school trustees open January 4th and run until September 1st. The municipal election is set for October the 18th. So these are this is what's happening. Now I'm gonna be moving on, talking about other stuff. So everything you need to know about COVID-19 in Alberta, Friday, January the 15th, 2021. So the latest, Alberta will ease some public health restrictions starting on Monday, allowing hair salons, barber shops, and other personal services businesses to reopen by appointments only. Dr. Dina Hinshaw, Alberta Chief Medical Officer of Health, said Thursday that the province made the decision for limited reopening for examining everything that was closed after Premier Jason Kenney UCP government imposed tighter restrictions in mid-December in the bid to curb the COVID-19 active cases, hospitalization, and ICU counts. As of Monday, up to 10 people will be also allowed to gather outdoors, and up to 20 people will be allowed to attend funeral. Indoor gatherings remain prohibited, and funeral receptions are still not allowed. On Thursday, Alberta identified another 967 new cases of COVID-19, up from 875 new cases the day before, since reaching a peak on December 1st, December 7th of 1,767 new cases per day. The 7-day average of daily new cases has been steady decline in Alberta. As of January 13th, the 7-day average was 875, which is roughly the level it was in the mid-November when the numbers were exploding. The province had 12,434 active cases as of Thursday, down from 12,838 on Wednesday. The total of active cases in Alberta has been dropping slowly but steadily since it peaked at 21,138 on December 13, a day after tougher provincial restrictions kicked in the made working from home mandatory for those who could, banned in-person service at restaurants, pubs, and bars, and entirely closed entertainment and recreation faculties. From movie theaters to gyms, personal and wellness service like spas and hair salons. A few days earlier, the province had also instituted a mandatory province-wide mask requirement and banned all in outdoor and indoor social gathering with people beyond one immediate household. There were 806 people in hospital Thursday, including 136 in intensive care. Another 21 people have died from a total of 1,389 deaths. That comes 2 days after the province hit grim new record with 38 new deaths reported in a single day on Tuesday. 12 schools, about 0.4%, are on alert or have outbreaks. With 15 cases in total, outbreaks have been declared in two of them, accounting for 5 cases in school. Transmission have likely occurred in 3 schools, and all three will only led to one new cases. The continuing decline in numbers means fears of post-holiday COVID-19 surge appear not to have materialized in Alberta, and experts say current trends are encouraging, but the province still has some ways to go before major public health measures can be safely lifted before the holidays. Kenny said he was concerned that Albertans might misunderstand or disregard the stricter rules imposed in December restricting family gathering, but it appears Albertans generally followed the rules and limited the spread of the virus. A post-holiday spike in cases would be expected to have shown up to data by now, but so far there has been no major increase. Alberta's case numbers and hospitalization remain high, and they pose a threat to our healthcare system capacity continue to, Shandro said. Today we can't entirely ease up this goal, but we can make small adjustments to provide Albertans with some limited ac- activities. So that's what's happening in Alberta. Now I'm going to be moving on to Ontario. Ford ousted MP from caucus over open letter pushing for end to COVID-19 lockdown. Ontario Premier Doug Ford has kicked York Centre MP Raman Barber out of the Progressive Conservative caucus for sending an open letter that calls for the province lockdown and COVID-19 restriction to end. In a statement issued Friday morning, Ford called the comments from the two-page letter irresponsible, saying Barber will not be allowed to seek re-election as a PC member. By spreading misinformation, he is undermining the tireless effort of our frontline healthcare workers at the critical time, and he is putting people at risk, Ford said. I will not jeopardize single Ontarians' life by ignoring public health advices. There is no room for political ideology in our fight against COVID-19. Rather, our response has been and we will always be driven by evidence and data, Ford said. Fortunate, Mr. Barb has put himself ahead of his PC caucus team, who have worked around the clock for months to support and protect the people of Ontario through this public health crisis. In our Barber's letter, posted on Twitter today, the MPP argues that while the virus is real, the fear of COVID-19 is tragic. Lockdowns are deadly than COVID. I wrote a respect letter to Premier Ford asking to end the lockdown, he said in a tweet. Barber wrote that the virus is not deadly as first thought and claimed Ontario's hospital capacity is better than pre-pandemic so far. More than 5,200 Ontarians have lost their lives to the virus. In response, the Minister of Health critical a fact sheet disputing or outright many of the central claims in Barber's letter. You can read the full text of ministry response at the bottom of this story. Moreover, the Canadian Mental Health Association issued its own statement saying that Barber's mischaracterized its research on connection between the pandemic and suicidal among adults in the country. At a time when so many Ontarians are struggling, we are disappointed that the MPP has, for political purpose, misconducted about the sensitive subject of suicidal, said Kamli Quinley, CEO of the organization. Barber's claims come as provincial officials and health experts alike have warned that Ontario healthcare system is on brink of being overwhelmed. The province began warning hospitals to prepare for transferal for patients across out of region just over a week ago, is now telling ICU doctors across Ontario to prepare to use critical care triage to determine who will receive life-saving care when ICU resources are limited. The public need to understand they're at risk of not getting the care they need. Dr. Michael Warner, medical director of critical care at Michelle Garner Hospital, told Thursday. Warner said implementing these critical would mean that not every patient who needs critical care relates to COVID-19 or not. We'd get the critical care of tragic comes into effect. It makes me very uncomfortable and moral distressing, and it's terrible for patients, he said. In series of tweet posted later this morning, Barber said he doesn't regret speaking out for millions of lives and livelihoods by public health and that he couldn't watch the suffering anymore. He called Ford move to turf him from caucus as a regretful decision since many colleagues agree with me. Meanwhile, Ontario reporting another another 2,998 new cases of COVID-19 this morning, as well as 100 additional deaths of people with the illness. In the further deaths are the most record on a single day since the pandemic began, though the Minister of Health said the 46 occurred earlier in the pandemic and were included today due to the data cleaning initially by the Middlesex London Health Unit, but offered no further detail. The previous single-day high came on January 7, 2021, when 89 deaths were reported. Ontario official death total is now 5,809. Today's new cases included 800 in Toronto, 618 in Peel Region, and 250 in York Region. Other public health units saw a double or triple digits increase: Waterloo Region 161, Niagara Region 153, Windsor-Essex 148, Hamilton 138, Ottawa 133, Durham Region 113, Halton Region 81, Scum 73, 73 cases, Middlesex London 61, Wellington, Duffer Gulf 51, Eastern Ontario's 27 cases, Brampton is 25, Huron is 20, Southwestern Ontario is 19 cases, and Alberta is 13 cases. Note all the figures used in the story are found on the Minister of Health COVID-19 dashboard or daily summary. The number of cases for any region may differ from what is reported by the local public health unit because local units report figure at different times. The new cases comes as Ontario network of labs processed a new record high 76,472 test samples for the novel coronavirus and reported a test positive rate of 4.6%, the lowest hit has been in nearly 3 weeks. The 7-day average of new daily cases dropped 3,273, while the numbers of active cases province-wide fell for fourth straight day of 28,825. The numbers of COVID-19 with COVID-19 in hospital decreased by 10 down to 1,647. Of those, 387 were being treated in intensive care, one fewer than yesterday, and 280 required to breathe. Another 15,803 doses of of the vaccine were administered yesterday. The province said a total of 17,004,630 shots have been given out so far in Ontario, and 17,904 people have been fully vaccinated with both doses. The federal government said Friday the global pharmaceutical giant Pfizer will temporarily reduce shipments of its vaccine to Canada because it's pausing some production lines at its faculty Belgium to expand long-term manufacturing capacity. Pfizer believes that by the end of March it will be able to catch up, such as we will be on track for the total committed dose. Q1 public service and Pro shipments Minister Antti Anand said referred to the first quarter of the calendar year. In a statement, Ford said the province is evaluating the possible impact of the news. We will adjust as necessary, recognizing the fact that Ontario will soon have baseline capacity to vaccine nearly 40,000 people a day with the ability to triple or quadruple this capacity with notes, the statement said. I know the federal government is working to secure more supply when they are able to deliver more vaccine. Ontario will be ready to administrate them. So this is the Ontario. There's already a guy got fired because of his comments, and we all know what happened, and it's really scary when that kind of things happen, especially people when they don't follow the health rules and you don't follow the health guidelines. This is a big deal and it's a big problem, especially in Canada when you see this kind of stuff. Now we're gonna be moving to world if there's anything world. Yes, we're gonna be moving to world. Um, Biden announces new vaccine SARS massive spending to stem COVID-19 suffering in U.S. U.S. President-elect Joe Biden has picked a former Food and Drug Commissioner to lead vaccine science as part of his drive to put 100 million shots into the arm of Americans in his administration's first 100 days to stem the COVID-19 pandemic. Dr. David Kessler, who will have the title of Chief Science Officer of COVID-19 Response, headed the Food and Drug Administration in 1990 under the president of both political parties. He has been acting as a top pandemic advisor to Biden, and his opponent was announced Friday by the President Transition Office. Kessler will work out of Federal Department of Health and Human Services, assuming responsibility for scientific side, Operation Warp Speed, an effort to launch under the Trump administration to rapidly develop vaccine and treatment. The driver has already helped produce twice highly effective vaccine and more on the way. He will replace Monto, a researcher and former drug company executive who led operations for the Trump administration, will become the consult to the incoming team. Kessler will work with Jen Wenzel, who will continue as the Chief Operation Officer. Kessler will coordinate vaccine review and approval, as well as the logistic and manufacturing millions of more doses. Experts say the U.S. will need to vaccinate upwards of 250 million people to approach the goal of herd immunity, where there is widespread resistance to virus, allowing for a return to normal life. That comes off heels of the announcement on Thursday evening in which Biden has unveiled a 1.9 trillion US coronavirus plan to end a crisis of deep human suffering by spending up vaccines and pumping out financial help to those struggling with the pandemic. Called the American Rescue Plan, the legislative proposal would meet